Hello guys, it's Unit 3, Part N.
Cardiotocograph. Cardiotocograph is nothing but cardio indicates the heart. Here it indicates the fetal heartbeat. And toco indicates uterine contraction, and graphy is nothing but graphical records. How the fetal heart rate or the rhythm, how the uterine contractions are connected with each other. We will see it in the form of rhythm. In form of graph, we will get the result. And the machine which is used to monitor it is known as cardiotocograph. It is also known as electronic fetal monitor or external fetal monitor. There are actually two methods. Those are NST and CST. First, NST. In NST, first we will provide a mother a comfortable position, that is mainly lateral tilt position, not the supine position. Lateral tilt position is like this. Supine position is if the patient is sleeping straight, that is supine position. Supine position is avoided to avoid supine hypotension. When the mother is sleeping straight, then there is a sudden fall of BP which is known as supine hypotension. So because of that, we avoid supine position, we provide laterally tilt position. At this time of examination, there are two sensors which is placed in the womb. That is, one is above the womb and other is near the pelvic region. There are two sensors that are placed and a button is provided in the mother's hand. We will advise her, when the patient is moving in your stomach, she has to press the button. If the fetus is sleeping, when we are placing the sensor, we will come to know the fetus is not active. So we will advise the patient to wait for 1 hour and then again come for an examination. Again, after 1 hour, when we place the sensor, the fetal beat should be active. If the fetus beat is not active, if the fetus is sleeping still, if the fetus is sleeping more than 1 hour, more than 60 minutes, it indicates the fetus has abnormalities. There is a problem, there is a fetal distress. That is why the baby is sleeping. The normal beat of non-stress test is 110 to 150 beat per minute. This is normal. This examination is performed for 10 to 20 minutes. See, when the examination is performing, that is in 10 to 20 minutes, the mother is advised to press the button when the fetus is moving in the stomach. So at that time, there are at least 2 times the examiner will take the count. In that 2 time, while taking the fetus heart rate, heartbeat count, the count should not be less than 10 or 15 beats from each other. Like for first time, if we get 120, the second time it should be either 110 or 130. 110 or 130, that will be the normal. If the beat is exceeding more than it or being less than this, then that is abnormal. The advantages of NST are, it's a non-invasive test. There is no cutting or insertion is seen in this examination. This test is very simple, it's not expensive, and the time is also less consumed. That is, within 10 to 20 minutes this examination will be performed. Next, there is no contraindication or complications. After performing this examination, there will be no problem that is seen in the fetus or the mother because of this examination. And no specialist is required for performing this examination. If a person knows how to perform this examination, he is enough to perform this. And the report will be provided immediately. This is not time-taking process. These are the advantages of NST. Indications of NST. Which mothers are advised to undergo NST? Those are the women who has medical conditions like diabetes and hypertension or any other medical conditions. They are advised to undergo NST and they are advised to keep screening regularly. And next, if the baby is less active, if the baby is not moving regularly in the interval of times, or if the baby is sleeping, generally we advise them to undergo this examination. And mainly if the baby is small, if the baby is not growing properly, for them also we advise to undergo this examination. And if the amniotic fluid is too less or too more, that is, we'll come to know by observing itself. If the womb is very big, that is, amniotic fluid is more. If the womb is very small compared to the months, then the amniotic fluid is less. Even at that condition, we will advise the mother to undergo NST. And if the mother has lost her baby previously, if the last pregnancy was ended up in abortion, then we will advise the mother to undergo this NST as a precautionary measure to save the next baby. Next, if the delivery is near, if the delivery date that is given is almost near, around 38th, 39th, 40 week, we will advise the mother to undergo NST examination. If the mother has any other complications like breech position or any other examinations like this, collecting any tissues, we will advise the mother to undergo NST first to see the internal environment, to see the baby's condition, whether the baby is healthy or not, and then we will advise the mother to undergo other examinations. This is the indications of NST. Basic terminology in NST. The first is baseline rate. Baseline rate is nothing but the fetal heart rate is in between 110 to 150 beat per minute in 10 to 20 minutes. That is known as baseline rate. That is normal rate. Next, bradycardia. Bradycardia is nothing but decrease in heart rate. Okay, so it indicates the beat per minute. The fetal heart rate is less than 110 beat per minute. That indicates bradycardia. Tachycardia is nothing but more. So if the fetus heart rate is more than 150 beat per minute, it indicates tachycardia. Baseline variation. Baseline variation in the sense how many counts it can vary from first to second beat. It can vary in between 10 to 15 beats per minute. That is, for first time it is 120, then the second time it can be 130 or 110. Okay. Acceleration. Acceleration is nothing but temporarily the fetus heart rate will be increased. While performing this examination, the examiner will take the count at least for twice. While taking the count, if the distance between first and second count is 15 to 10 beats, like 10 to 15 beats, it's okay, it's common. But sometimes, like 1 or 2 times, the fetal heart rate will be increasing more than 15. That is, for first time if you take 120 beats per minute, for second time it will be 140 beats per minute. For some time, at least 1 or 2 times, the beat will be increasing more because of fetus hyperactiveness. That is common. Again it will become normal. Next, deceleration. It is nothing but a decreased fetal heart rate. That is also temporarily. These symptoms generally can be seen at the time of delivery or when the fetus is moving downwards. Descent is nothing but movement of the baby. That is because of the contraction in the uterus, the fetus will be moving. That is known as descent. And at that time, sometimes the fetus heart rate will be decreased, and that is also temporary. Okay, that is descent. These are the terminologies that are seen in NST. Questions will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video.